looking up this image for our viewers, and there's a few conditions I'd like you to kind of tell us what's happening. For example, you can have a degenerative disc disease, spinal stenosis, kyphosis. Can you walk us through those three and tell us what they are?
Yes, absolutely. So the first picture here is of degenerative disc disease. You see it highlighted in red. These discs now are narrow, they're irregular, and the cartilage in between is thinned out, and of course the gel inside the disc is already dried out. When this occurs, it puts a lot of stress on these elements in the back. These are the small joints called facet joints, and it narrows the space between the vertebrae. These are the vertebrae, the big squares, and it narrows the space where this nerve has to come out. Okay? You can see this is a normal looking disc here, the last disc at L5S1, but these are all abnormal.
All right. And what about the other one, doctor, which is kyphosis? Can you touch upon that real quick, if possible?
Yes. So kyphosis is another example of when we start to slouch and bend forward and the spine takes a different type of curvature. This is the mid-back or the thoracic spine. And you can see it's accentuated like a C. And it's actually more bent forward. And this can occur, and we start to crouch over like this. And we see this a lot in patients with osteoporosis, this excessive kyphosis or bending forward like this. Now, there are other reasons to bend forward, but when we get older, the front part of the vertebrae start to wear down and compress. They can even fracture, called compression fractures, particularly important in patients with osteoporosis. And we develop that kyphosis, and you'll hear patients say that I'm getting shorter with age, and that's true. We are all getting shorter with age.
That's already happening to me.
It happens to everyone, don't feel bad. And it's part of the aging process, but it's especially prevalent in people with osteoporosis.